Hey, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and tonight we're talking about hearts. Isn't that exciting? It's Heart Month. So we have two guests. One, we have Erica Mountjoy. She is a nurse practitioner, so you know us nurses will just chit-chat about nursing stuff. And then the second part, we've got one of the doctors that treats heart failure over at the hospital. So I'm really excited about this. We have such a superior cardiac group over there, and you know there is not any part of your heart that cannot be taken care of at NASH, other than I guess they don't do open heart, do they?
No.
But anything else they can. So it's just wonderful to have that. So Erica, welcome. Welcome to, how long have you been over at the hospital now?
About 2.5 years.
Oh, it's been that long?
Mm-hmm.
Oh,
I know, it's flown by.
How time flies when you're having fun. Yeah.
Yes.
So you live in Raleigh, you said?
I do. I live in Raleigh with my husband.
Okay, good. And where are you from originally?
I was born in Pennsylvania, but I've lived in North Carolina almost my whole life. I grew up outside of Winston-Salem in Clemens, North Carolina.
Okay, all right. Mm-hmm. And when did you decide you wanted to be a nurse?
My mom's a nurse, and I really didn't think about it till right at the end of high school, and then it just clicked. And good. I went to UNCG in Greensboro for my undergrad, and ultimately ended up at UNC Chapel Hill with my nurse practitioner.
Good. Awesome. Yeah. I have a friend that works over there that went to UNC. Okay. Susan Baker. Do you know Susan? Maybe you don't. She was a hospitalist, and now she's working, I think, in the pediatric pediatric part of the, it's not an ICU. What is it? I don't know what they call it. Anyway, so how long have you been practicing as a nurse practitioner?
The same, about 2.5 years.
Okay, so you're fresh out of school.
Mm-hmm. Yes.
Awesome. Yeah. I think nurse practitioners rock. I tell everybody they do. They're much better than PAs. Not really. It's just that it's different. The training is different, and nurse practitioners have a lot more autonomy than PAs do. Yeah. But anyway, we won't go into that. So, what made you decide you wanted to go into cardiology?
I actually started out when I was in nursing school. I was getting my CNA training, and I started out in a cardiac telemetry unit as a CNA. I've always been in cardiology. Okay. At that time, I just fell in love with it. I loved the patients. I loved all the different, complex problems that present in cardiology. Something about the heart is just very challenging, but I really like it, and just very interesting, keeps you on your toes.
That's awesome.
Yeah, so I've always loved cardiology from the time I was a CNA. Just kind of stuck with it.
Yeah. It's pretty interesting, isn't it? How you fall into something. And I was an ER nurse, and I loved the ER. I did work in a telemetry unit too at one point, but ER was in my blood. But that's for the young. I got burnt out after a while, but what the ER did for me was train me how to be a good nurse practitioner, because I'd seen everything in the ER, so it was really good training. I didn't realize it at the time, but it does. So what is the favorite part of your working at the congestive heart failure clinic?
I think my favorite part is being able to have a good relationship with the patients. We really form we typically start seeing them in the hospital, and then they follow up with us, and we see them so often that you just really get to know your patients and most of the time see them get better. So that's probably the most enjoyable part.
Right. So do you round with the cardiologist at the hospital?
I do.
You do. So then they get to know you right then and there.
Right.
That's awesome. So how many do you have now? How many patients you got under?
Oh gosh, I don't know.
Can't keep track of
I don't know. Yeah, I honestly probably around 200. I'm not sure.
Okay.
Yeah.
And
maybe more. I really don't know.
Yeah. So how many do you see in a day? How does the clinic work? I don't know.
So typically the clinic works when I'm in clinic. We start around 8:30 and typically see patients about I typically see about 15, 16 a day. But at the same time, we also have the diuresis clinic, which is a little bit separate from the regular congestive heart failure clinic. So we offer that service as well.
Okay.
So typically doing both.
Okay. So tell the audience what diuresis is, because they probably don't know.
Diuresis clinic is where if your diuretic or fluid pills aren't working as well, so or something has happened to where you've built up more fluid and your pills aren't working anymore, we have the option of giving you diuresis through the IV and get some fluid off pretty quickly, which will help keep you out of the hospital and help get your medications working again. So that's what we do for as long as you're stable and we don't feel that anything else is going on that needs that warrants hospital admission. That's where the diuresis
awesome,
clinic comes in.
Otherwise, they're in and out, because you walk such a tightrope with congestive failure, because a little too much fluid and you're going to flip this way, and a little too dry, you're going to flip that. It's hard to find that happy medium. So that do you have parameters for your patients? You know, you weigh yourself every day. If you weigh 7 pounds more, what's your weight?
Typically what we tell our patients is weigh yourself every day, first thing in the morning. Get up, go to the bathroom, and then stand on your scale and weigh and keep a record of it. If you see a 3-pound weight gain in one day, that's when we are concerned about fluid, or 5 pounds in a week.
Okay.
So if it's kind of trending up pound by pound by pound by pound, that's a sign of the fluid coming back on, and that's when we would instruct them to take an additional diuretic or fluid pill, or call us and let us know.
Okay.
Because we want to get ahead of it.
And so most of the patients, they're cooperative and do that?
Yeah.
Okay. So does the hospital years ago, I don't know if they still do, when you had a diagnosis of congestive heart failure, they would give you a scale?
We have started doing that again.
Have you?
Yes, we have. We've started doing that. We have, we actually now even have a nurse navigator that just started with us.
Oh, great.
So she's wonderful, and she, in the hospital, she'll talk to the patients, give them education about congestive heart failure, and we provide a scale. That way, you know, we know they have a scale to keep track when they get home, when they get out of the hospital.
Yeah. Just for FYI, you might have one that collects them and gives them away for Christmas presents, because that happened when I worked at the hospital.
We've heard of some of those stories, but I do, it does make me happy when I see patients in clinic after being hospitalized and they're using their scale. So.
Right. So a typical office visit for you then would be seeing somebody, checking, tell me what you do for not somebody that's overloaded, but just, coming in for a follow-up.
If you're coming in for a follow-up, what we're doing is we're, of course, assessing you for fluid. Are you compensated, meaning do you not have too much fluid? Are the diuretics working? But also, we are adjusting your core heart failure medications. So anyone with congestive heart failure is typically going to be on about 3-4 core medications, and we want to adjust them to the optimal dose that will help them the most for their heart failure. So that's typically what we do.
And there's degrees of heart failure, right? Is there classifications? Tell us about those.
There's classifications. When you're talking about systolic heart failure, which is when your heart pump is weak, we classify that. Typically, by the time you have symptoms, you're around a class C, which means we're seeing that weakness on the echocardiogram. And that's when you might start having symptoms, and that's typically when people get diagnosed, unless it's caught earlier than that. And so there's degrees of heart failure on how weak the heart is, and then there's degrees of your symptoms, and when your medications are helping, and when you're watching your sodium, and you're watching your fluid intake, and you're keeping the fluid off, typically you can be pretty functional. It's when you're not able to complete your normal daily activities without having to stop and catch your breath, that's when we start worrying about fluid buildup, and is the heart failure progressing. So
Yeah. And so is there somebody on call? I know you're not there 24/7. I would hope not anyway. But I mean, somebody feels like they're in trouble at 8 o'clock at night. Can they call or go to the ER, or what do you tell them to do?
So if they're significantly short of breath or have chest pain, we would recommend ER. If it's evening, 8, 9 o'clock at night, they just know that their fluid's coming back on, something's not right, what should I do? There's a couple different things they can do. We actually have just started having a community paramedic who is going to be following with patients with congestive heart failure.
Interesting.
So we, at my visits, I always give out that phone number. They can call them and find out, talk with them, and they can kind of help triage what they should do as far as going to the hospital or taking an extra fluid pill. And then we also have, the on-call cardiologist as well. That's on call for the hospital.
Right. So this paramedic, is it just one, or they take shifts, or?
Right now there's one. But in the future we're hoping to have more than one, and they can kind of take shifts and alternate.
Okay. Awesome. Wow. Let's see. I had a question in my brain and I forgot. So how many days are you in the clinic?
I'm in the clinic almost every day. I'm there Monday, Tuesday, half a day. Wednesday, I'm in the hospital when I'm not there. So I'm in the hospital all day on Thursdays, and I'm in clinic Friday. So most days I'm in clinic.
Okay. So how many nurses work with the diuresis, the IV diuresis? Is that every day or as you need it?
Yes. So it's both. So it's always an option, and if something comes up when I'm not there, we are typically able to work it out where someone can do the diuresis treatment, and typically it's one of the clinic nurses is able to kind of staff both both clinics, and we always check. The main thing that we do is monitor the urine output during the treatment. So once we would start an IV, give the IV medication, and then monitor the urine output. Of course, we're monitoring blood pressure, heart rate, oxygen, making sure all of that is stable throughout the treatment.
Sure.
As long as everything's going well, typically we give 2 treatments in 4 hours.
Okay. And then if something happens, you can always put them in the hospital if you have to, I guess. Yeah. So can I refer somebody to you, or do I need to send them to the cardiologist and let the cardiologist refer to the heart failure clinic?
You can send, as long as the patient has, so for diuresis, if you're concerned, say one of your patients comes to you that has heart failure and you're concerned that they need the IV treatment, they would need to establish with us if they're not already established with us. However, if you have a patient with congestive heart failure that you want followed with the CHF clinic, you would just refer them, and either myself or Dr. Jaganathan would see them.
Okay. And so how much education are they getting? You said that they're now as a nurse navigator, so because it's pretty complicated and it's complex and it's scary when you can't breathe. So
it's a lot of education.
Is it?
I would say, if not the majority of the visit is education with the patients, especially if it's a new diagnosis for them.
Okay.
Definitely. And at first, as we're adjusting medications, we're seeing you pretty frequently, and we just kind of build and build and build with each visit.
So you get them stable. So what exactly is the nurse navigator doing through all of this?
So she's primarily providing education in the hospital, and then she's following up after hospital discharge. And then she helps keep track of some of our patients that we know are, patients can call her with symptoms. And so she's a good kind of like a liaison between patients and providers, so that, we can get to them if they have symptoms pretty quickly and address things pretty quickly. She helps follow some of our more sick patients as well.
Okay. Sounds like you've got it going over there. I mean, it sounds like you're learning how to cover all your bases, which is awesome.
Yes, I mean, since we've started, you start a program, and then you kind of realize all the resources you need, and we've been,
of course,
slowly getting them. And Nurse Navigator is very helpful. She's been so helpful connecting patients with resources in the community that can help them. I mean, there's a lot to address, socioeconomic wise, insurance wise, and just everything. Transportation, eating, paying for your medication.
It's cheap to get a hamburger and French fries at McDonald's, and it's not so cheap if you got to go to the grocery store and buy fresh food. That's always been one of my angsts. I've got many, and I get on many soapboxes, but
that's right,
people, they just do what they have to do, and people, they don't know how to cook.
Yeah, we do. We do
how to
see
cook?
that.
You're young. Do you know?
I do. Yeah. But yeah, I mean, we do see that, especially when if your spouse has passed away and they used to cook for you and you never had to cook, and now what do you do? Yeah. We do see that.
Yeah. So. I see that a lot. That I don't know how to cook. Well, I grew up, my mom taught me, but I guess, I don't know. I'm old, so I'm old school, so I'm not going to say anything about that. But I did tell a patient today, I said, well, you can get HelloFresh, or they got all these boxed foods now that come with instructions and all this. So you need to do that instead of, she goes out to eat 5 days a week.
Oh, yeah.
I don't know how you can afford it. I don't know. But anyway, okay. So, what do you do? I'm going to slip back to your personal life a little bit. What do you like to do for fun?
I like to be outdoors, pretty much anything outdoors. I love to be outside, go out hiking, get out on the water. I live near the lake, and I just enjoy being outside. So past couple weeks has not been too enjoyable for me.
I'm an outside girl too, so it's been pretty tough for me because and we have animals, so my husband was in the hospital, so I had animal duty, and with all that rain, and then the goats and the dogs don't even come out to see me. They're like, oh no, it's cold and rainy out there.
Oh yeah, even my cat was depressed. So
I know, right? And now we might get ice, so they tell me. But I love being outside. I love to garden. That's one thing I like to do, and I like to read. And okay. So Erica, just tell me, where is the clinic, and how do I call you? You have a number?
We have a number. We're UNC Cardiology at Nash, and that's the best way to call us is I don't have the number memorized, but you can.
It might be on the screen.
Yeah.
962-2328. Okay.
You can Google it. But yes, give us a call. And we are in the buildings behind the hospital. So we're on the campus of the hospital, back behind, kind of behind the Women's Center.
Okay.
Most patients who have lived here a long time are like, oh, you're in the old pediatrics clinic.
Oh, yeah.
So they know us as the old pediatrics clinic.
Okay, that's it.
Yeah.
Well, Erica, it's been a pleasure to have you with. Thank you so much for coming and taking time out of your night. I know you're ready to go home and be with your hubby and I hope he's cooked supper for you tonight.
He pretty much cooks every night now.
Does he? Does he? Yeah, whoever's home.
He's hungry, so.
Yeah, there you go. All right, well, we've had a time with Erica Mountjoy, who is the nurse practitioner that is running the congestive heart failure clinic with the doctors, of course. And we are now going to have one of the cardiologists come and talk to us more about heart failure. So don't go away, and we'll be right back with more of Here's Your Good Health. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
I came to the emergency room because I was having what seemed to be an episode of AFib. I was very, very scared and wasn't sure exactly what was going on. They told me that they were going to do a catheterization. I was just totally blown away. The kindness, the compassion, the nurses, I was treated better than I've ever been treated in my life. I was just so excited that I could do it here at home at Nash UNC.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Well, welcome back. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And this is Heart Month. February is Heart Month, and so we've been talking to Erica Mountjoy about the Congestive Heart Failure Clinic. And now we're going to talk about the disease process itself with Dr. J, because I'm going to murder her name. And you know, I'm pretty cognizant of names with a name like Prezioso, because I've been called Prozac, I've been called Pinocchio, so anyway, so Welcome. I haven't had a chance to meet you yet. Welcome
Thank
to
you.
Rocky Mount. I guess do you bounce back and forth to Chapel Hill, or how does that work?
Yeah, I do. I spend most of my time here at Nash, but I also work in an LVAD clinic at Chapel Hill, which is a left ventricular assist device or a mechanical heart pump clinic at Chapel Hill.
Oh, interesting.
And I also round at Chapel Hill on the advanced heart failure patients, which are our transplant patients and our LVAD patients as well.
Interesting. See, when you're in the hospital setting, you know about all this stuff. But I've been out of the hospital for 10 years, and so I don't know about, you don't hear about that, because I just talk about diabetes, hypertension, hyperlipidemia all day long.
Very important stuff.
Yes, it is. Yes, it is. So what made you become a doctor? What did you want to do to get into the medical field?
So my dad is a cardiologist.
Oh, okay.
And that was a big, obviously motivation at home.
Sure.
I knew in high school that that's what I wanted to be. I ended up going to medical school in India just for diversity and to learn
Awesome.
more about the culture and
Sure.
the different patients.
Sure.
And then came back here, did my residency in Ohio, worked as an internist for 6 years in between, and then went into fellowship in Ohio as well. Came to North Carolina for family reasons, and finished up my training in advanced heart failure at UNC Chapel Hill, and here I am.
Here you are, and aren't we blessed to have you? That's just awesome. So are you married? Do
Yes.
you got children?
Yes, I do.
Ah.
Married, and I have 3 kids, 3 wonderful kids. They're
Of
young,
course.
twin boys and a daughter.
How old are the boys?
They're 8, almost 8. Their birthday's coming up.
Okay.
And then my daughter will be 6 in May.
Oh boy, that's double trouble when you got those twins, isn't
Yes,
it?
it is.
Double blessing.
A lot of
though,
fun.
too. Yeah. Oh yeah. Oh yeah. And boys love their mamas.
Yes, they
I'll tell
do.
you, they sure do. So, how long have you been in medicine then altogether? With schooling is forever, I guess.
Yeah, I think I've been in practice for 15 years.
Okay.
Yep.
You don't look old enough to even be in medical school, I tell you.
Looks are deceiving.
Okay, so how did you end up in Rocky Mount? I guess the cardiology department is kind of just an extension of Chapel Hill, I guess, for lack of a better explanation. Is that about right? Or,
Yeah.
Okay.
Yeah, that does. It sounds right. It's the physicians that are at Nash also, some of them work at Chapel Hill too. We didn't have an advanced heart failure presence at Nash, and so I finished my training at Chapel Hill. We talked about just bringing more awareness and that heart failure presence at Nash, and I thought, it would be great. Our population here needs more care for their heart
Yes,
failure, and,
yes.
and this was the right decision.
I'm glad. We're so blessed to have you. That's awesome. So we're going to just talk about heart failure. So what exactly is heart failure?
So heart failure, like Erica had described, it's the pump function of the heart that starts to fail. So you have the left side and the right side, and more commonly we talk about the left side. So there's an initial insult. It could be a heart attack. It could be long-standing high blood pressure that has wreaked havoc on the heart. It could be toxins like drugs or alcohol. It could be infection. It could be even things that run in the family. So whatever this process is, happens, and the heart pump starts to fail. And this then, the heart sends abnormal signals to the brain and to the kidneys and the other organs in the body. And these abnormal signals make the body retain fluid and salt. The blood pressure drops, other abnormal hormones are sent out, and it kind of is a vicious cycle. And so the heart starts to fail more. We also have the other kind of heart failure where the heart pump function can be read out as normal, but the heart is stiff and it's just not able to relax. And more commonly, we see it in our elderly patients, in our patients with long-standing high blood pressure, in patients with abnormal rhythms, like atrial fibrillation or atrial flutter.
What about like atherosclerotic disease? Can that cause or promote heart failure as well?
Yes, it can. So like a actual heart attack, patient comes in the hospital, presents as a heart attack, or even just the small tiny blood vessels in the heart that get clogged off because of atherosclerosis, that can cause microscopic damage to the heart, which will lead to abnormal pump function of the heart.
Gotcha. So what about like stent placement and stuff? All that can contribute to it, I guess.
Yeah, and so that's one way to fix a blockage in the heart. But if heart failure develops, it really kind of depends if it's in the setting of a heart attack, how extensive the heart attack was, and how quick we can fix it.
Yeah, and we can go pretty quick these days, but but that heart's pretty tender too it comes to that. So so that's what heart failure is, and we talked about the causes. So how does someone feel with heart failure? Why would they go to their doctor? What kind of symptoms would they have?
So usually it's the things that they normally do, so if they go for a walk around the block, or go to the park with their kids and they're just not feeling as up to it anymore, or the same level of activity is making them more short of breath, even just more fatigue. I'm just generally just more tired during the day. And then what they could also notice is just more puffiness in their feet, in their hands. They're putting on weight, although their appetite hasn't changed. They're not eating as much. Their clothes are fitting tighter. That could also be a sign that they're putting on fluid too. And so with these kind of being the main symptoms of heart failure, then somebody can go to their primary care doctor and talk to them about these symptoms. And at that point, depending on their risk factors, like if they have a history of heart disease or blockages, or if they have long-standing high blood pressure, then can this person be at risk for heart failure? And this could prompt then the primary care physician ordering an ultrasound of the heart to see if that might be the case, and then obviously referring them to us, and we can take it from there.
I got a candidate right now. He's getting his echo tomorrow, but his BNP is up and he's short of breath. So, so what's your favorite thing about the heart? I mean, obviously you know all about all the aspects of it. So do you have a favorite part? Is congestive heart failure and treating it most satisfactory to you, or?
Yeah, I like it when our medications, I know that our medications work. It's been studied extensively, and when it's taken right, I love seeing our patients get better and them feeling better. And if they don't, then I love being able to present them other options because of the advanced heart failure treatment that I have, that there are other things. It's not the end of the road.
That's great. So how many are there with your particular training with all the advanced heart failure? Is that kind of a specialty unto itself, or it is? It is.
It was an additional training that I did after my cardiology training, and it's so at UNC Chapel Hill we did a little bit more than 30 transplants over the last year and about 40 LVADs. So we see a lot of these patients.
That's a lot, isn't it? Yeah. So how important is diet in taking care of your heart?
So it's very important. It's what a patient can do for themselves, obviously apart from taking their medications. It's very difficult, especially with the current socioeconomic status of our patients, but I ask that they do their best. So sometimes it's unavoidable to eat out, especially if someone can't cook. And I think it's important to read labels. Watch the sodium intake. What we usually recommend to our patients is no more than 2 grams of sodium a day. With fluid intake too, no more than 64 ounces or 2 liters of fluid a day. And so making just even minor changes daily or weekly make a big difference overall.
What's kind of the average age for heart failure? I think it's happening younger and younger from what I see.
Yeah, we do. We are seeing younger patients with heart failure, but we have a large population of Medicare patients with heart failure now, so the older population. And it's just because we're doing a great job in medicine, and people are living longer. So we're seeing some of the long-standing chronic illnesses, leading to heart failure the older they get.
I really wish that there was some way. We're so lacking in the dietary education. I know the hospital has dietitians, but they're pretty busy with just the hospital. And I've got to send all my diabetic patients have to go to Boyce Willis because we're a small clinic. We don't have an educator there, but that's about it. And so I got a lot of folks that fall in the cracks, and I really wish there was more dietary education. Maybe that's something we can work on to get it better. So so when you go to the doctor and you're short of breath, can your doctor just can I give somebody some Lasix and they'll be okay?
Well, I think it's important to figure out, why they're short of breath. I mean, there's obviously multiple reasons somebody could be short of breath. And it's just knowing that patient, what their risk factors are, what data points do you have? Do you have that heart ultrasound? Do you have some labs and some abnormal labs that might suggest heart failure? And then at that time we could talk about Lasix. But Lasix, I feel, is just more, obviously we get our patients feeling better with the diuretic or with the water pill. But it's the combination of all the medicines that we use that what keeps our patients living long.
Right. All right, it's time for our break, and so we will come back in just a minute with Dr. J with more questions. Now, we're live tonight. Oh, are we live? I don't know. Anyway, I'm live right now. It's been a long day. But you can give me a call at 407-1111. So if you've been to the heart failure clinic, or you've seen Dr. J, or your husband was just diagnosed with it, give us a call and we'll talk about that. All right, we'll be back in just a minute with more of Here's to Your Good Health and heart failure for Heart Month. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
I came to the emergency room because I was having what seemed to be an episode of AFib. I was very, very scared and wasn't sure exactly what was going on. They told me that they were going to do a catheterization. I was just totally blown away. The kindness, the compassion, the nurses, I was treated better than I've ever been treated in my life. I was just so excited that I could do it here at home at Nash UNC.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. We're here with Dr. J, and we're talking about heart failure. It's an interesting subject, at least to me. I'm sure it is to you as well. So we're going to talk a little bit more about things about heart failure. So is heart failure curable? Can you cure it?
So that's a really good question, and I will have to say no. Once you have heart failure, we know that at a molecular level, there's changes to the heart muscle that really can't be reversed. But with the help of medications and our other treatments, we can get someone feeling better and back to normal, leading a normal quality of life. The heart function can improve over time, but the importance of taking the medications is always there, and that will help keep the pump function from going back down again.
And I'm sure, just as in every other phase of medicine, there's continual new medicines on the horizon, and they're always finding something that works a little bit better or works a little bit differently. So
yes, of course.
That's always something that we can look forward to. So let's say that I'm in the ER and I've got congestive heart failure. So what's going to happen to me now?
So, going to the ER with those types of symptoms of shortness of breath or swelling, the ER would do some preliminary tests, including an x-ray of the lungs, some blood tests, and depending on the abnormalities that are found in there, if the heart failure has gotten to a point where it's affected the kidneys, or maybe there's some acid buildup in the body, and if the ER feels the person needs to come into the hospital, then the cardiology team, in specific the heart failure team, is consulted. And so between Erica and I, one of us is always in the hospital. And so the patient is then admitted to the internal medicine team, and the cardiology consult or the heart failure team is involved from admission.
Okay. So what does heart failure do to your kidneys?
So the kidneys, like I had mentioned in the beginning, that the heart sends abnormal signals to the organs in the body. The kidneys actually think that the body doesn't have enough fluid. Because it's not getting enough blood supply from the heart, the kidney thinks there's not enough fluid in the body. So the kidney number, what we call the creatinine, starts to rise. But in actuality, there's just a lot of fluid buildup in the body. And when we take off that fluid and we block all those abnormal hormone responses that the heart's sending, then we kind of put the body back in its normal state. And so those numbers, what we expect is things to kind of settle down and trend back down to normal.
Okay, that's really interesting how it all works together. Any other organs that are affected like the kidneys are?
Yeah, so the brain, where somebody can be more tired than usual, they're finding themselves sleeping more, they're not able to think, they feel confused, they're not able to process information the way they used to. The liver also can fail because the fluid builds up in the liver. And so the liver enzymes, that's a blood, a lab draw, we can see that in the blood too.
Okay, interesting.
Yeah.
Wow. All right, so there's no cure, so is there ever an acute heart failure, which means it just happens, or is it all chronic, or tell me the difference between those two?
So acute heart failure can be seen in some sort of sudden or acute insult. So a heart attack, that, we're hopefully able to put a stent in on time and fix the blockage on time. Or we can even see it in infections, like what we call a viral myocarditis, where an infection can cause inflammation of the heart muscle. So that can present very suddenly. And with COVID times too, we're seeing that as well, COVID affecting the heart.
Oh, so let's just talk about that. We'll veer off. We'll go on a little rabbit trail for a minute. So what kind of things are we seeing from COVID, and what's happening with the hearts?
So we're seeing many things because of COVID, and obviously we're discovering things as we go along. But some of the things that we've seen is COVID can cause little clots to form, and those clots can shower down those arteries of the heart and cause blockages and cause a heart attack syndrome. Secondly, the virus itself affects the heart muscle, and so this causes inflammation of the heart muscle, and this presents as either just kind of heart failure symptoms like the shortness of breath and the swelling that progress over days to weeks, or more sudden where the patient collapses and being brought into the hospital emergently and we're having to do life-saving therapy.
Wow. Yeah, my husband had COVID and he was hospitalized. They sent him home, and then he became increasingly short of breath, and we went back to the hospital, and the hospitalist said that it was either heart failure or pneumonia that had not resolved, or bronchitis, or a combination thereof. I mean, unfortunately nobody knows. You're only learning as you go and learning how to treat as you go. So you said that it can cause little blood clots in your heart, and those could go into your lungs as well, can't they?
Yes, they can go into your lungs as well.
And then if you have a pulmonary embolus, would that set you up for possible heart failure?
It does. So, the lungs and the heart sit right next to each other, and any kind of insult to the lungs too, really bad pneumonia or a clot in the lungs, the right side of the heart or the right ventricle sees that pressure in the lungs, and so we see right-sided failure from insults like that to the lung. And as heart failure specialists, we deal with that too.
Okay, you just got it all. So tell us again. Do we have time? Yeah, we've got time. Let's talk about the socioeconomic problems of this particular area, because you're from Chapel Hill, so you probably don't see it as much as we do here. But I think we probably have a higher, we don't, but I would think that we probably have a higher population of problems, and I think a lot of it's probably socioeconomic. You can't get good foods. You're taught as a toddler to put sweet tea in a bottle and give it to a baby, so everybody wants to drink sweet tea, which is one of my big angst in this part of the country because I'm not from here. And but and then it's just cheaper to go to McDonald's than it is to go buy good food and cook it.
Right.
So how are we going to fix that?
So it's
miracle worker.
Definitely, our patient population here is different than Chapel Hill, or even from the patients in Ohio. And I think the important thing is to recognize those barriers, because those barriers are different here than they are in Chapel Hill.
Right.
So like you said, it's education, first of all. It's understanding what havoc high blood pressure can, have on your body, what it can do to your organs, for example. It's recognizing that smoking and bad lifestyle and alcohol also do the same things to your body and can cause blockages in your heart that can lead to heart failure and heart problems. It's transport issues, being unable to get to the grocery store, being unable to get to your doctor's appointment. It's the lack of understanding of medications. What do they do for me? Why am I taking all these medications? Why do I have to take it 3 times a day? Why can't I take it once a day?
Right.
And it's also just kind of getting a better grip on their disease state and the importance of everything. And our team at NASH focus on that. We understand those barriers and we try to work through those barriers. We try to provide whatever support we can for our patients. We try to get to see them more frequently, even phone visits, to check up on them to make sure that medications are going okay. Do they have any issues? We also are implanting a device called CardioMEMS at NASH, which is an internal pulmonary sensor device. So patients can be at home, lay on a special pillow at home, and it transmits those readings to us, so we know what their fluid levels are, and manage them at home and keep them out of the hospital.
Wow, that's really Star Wars stuff. Next time you come, you're going to have a wand like Dr. What's-His-Name, Bones on whatever that show is. So do you think that you're going to start having some educational programs to help folks learn about their disease? And,
yes.
And, probably spouses need to be involved so they don't, well, just have one little glass of wine, honey, it'll be all right. So that would be awesome. You think that y'all working on that? Yeah, and we provide that education as an inpatient right now, but things are overwhelming for the patient in the hospital. Yeah.
So we're also, between Erica and I, providing that heart failure education in the outpatient setting. But what we'd like to do, and hoping in the very near future, we're going to have more structured kind of classroom style education in the clinic, invite a few of our patients over with their loved ones, and so that they can hear about heart failure, the importance of the medications, and kind of what to do moving forward. That's awesome. So let's just go over again, where exactly is the heart failure clinic located? So UNC Cardiology at Nash, we are behind the hospital next to the Women's Center. The old pediatric building. The old pediatric building. And the number is 962-2328, or you can just call the hospital and ask for it, I'm sure, and they'll send you over that way. Yep. So what about a referral? Can people just call Erica and say, I want to come see you, or do you have to have a referral from your doctor? Or yeah, I think that the getting a referral from your primary care doctor is important, so that at least the referral can happen to the right physician. If this is a primary lung problem, is this actual heart failure? So a referral coming from the primary care physician right to the heart failure clinic. Awesome. So I'm sure all insurances are accepted and all that. Of course. Of course. Of course. Let's see.
What's your favorite thing about the heart? Did I ask you that?
You did, but I'll answer that.
Okay, sorry, I can't remember what I asked when I didn't.
It's the heart is absolutely fascinating. The hemodynamics and the just the close relationship to the other organs, and how with the heart failing, what it does to the rest of the body.
Yeah, it really is interesting. So, and Daddy being a cardiologist just helped along, didn't it?
Yes, it did.
Yes, yes. All right, well, that's our show for tonight. Thank you so much for watching, and we will see you next week with more of Here's to Your Good Health. Good night.